Hello everyone. Welcome to the first Evidence for Global and Disaster Health webinar. I'm delighted so many people can join us today. I can see on the screen that one person is phoning in. If you'd like to send me an email, then I can share the slides with you. And for everyone else joining us, we'll share the slides and the recording afterwards. My name is Emma Farrow and I'm a member of the IFLA Evidence for Global and Disaster Health Special Interest Group. We're running this webinar in conjunction with Evidence Aid as part of Humanitarian Evidence Week 2018. And you'll hear more about how our group was established and about the work of Evidence Aid during the presentation. We can go on to the next slide. So today we'll be looking at finding the evidence for global and disaster health, and I'm delighted to introduce our two presenters. We have Caroline de Brún, who is Knowledge and Evidence Specialist at Public Health England under the Knowledge and Library Services team, and Isla Kuhn, who is Medical Librarian at the University of Cambridge Medical Library. If we have a look at the next slide here. Here's the session outline. So Caroline and Isla will be introducing some key resources after looking at the context of how we got to this point. As we're going through the resources, if you have any questions, please use the chat box and we'll be monitoring them and we'll respond straight away, but there'll also be the opportunity to ask questions at the end. And finally, from me, if you're experiencing any technical problems, please either email me or use the chat panel to contact me, and I'll do my best to support you. Okay, let's get started. So I'm now going to mute my mic and I will hand over to my colleague, Caroline.
Hello everyone, thank you for listening today. Before I start, I just want to let you know we have a Twitter hashtag, which is hashtag E4GDH, Evidence for Global and Disaster Health. So you can follow us there to find out more, and also if you want to post there, please go ahead. So where are we going first? Oops, bear with me 1 minute while I move the slides. Okay, I'm too delicate. Right. So how did we get to this stage? I'm just going to explain the background to the work we've been doing recently, and then we'll go into describing the resources. So in March 2017, Healthcare Information for All, Public Health England and Evidence Aid launched a project to look at how library services can best support global and disaster health. So just a bit of background about these three organisations. Public Health England is the national public health agency for England, existing to protect and improve the nation's health and well-being and reduce health inequalities. It does it through advocacy, partnerships, world-class science, knowledge and intelligence, and the delivery of specialist public health services throughout England and further afield when needed, for example, during times of disease outbreaks. Healthcare Information for All, or HIFA, is a professional global health network working in collaboration with the World Health Organization and currently supported by the British Medical Association, TDR, which is WHO's special program for research and training in tropical diseases, the Lancet, and more than 280 other health and development organizations. HIFA brings together more than 16,000 stakeholders representing more than 2,500 organizations across 176 countries worldwide, with a common vision of a world where every health professional, citizen, researcher, and policymaker has access to the healthcare information they need to protect their own health and the health of others. In a short while, Isla will go into greater detail about the work of Evidence Aid, an organisation which aims to inspire and enable those guiding the humanitarian sector to apply an evidence-based approach in their activities and decisions to ensure those in need receive humanitarian aid in the most timely, effective and appropriate way possible. As part of this work, we produced an evidence briefing, searching CINAHL, Embase, Global Health, Lister, Medline, PubMed and Google to find the evidence around knowledge and library service provision and knowledge management to support global health and disaster and emergency preparedness. We specifically looked at natural and man-made disasters, for example, flooding, wildfires, etc., and disease outbreaks such as Ebola and Zika virus. Key findings described alternative functions for libraries during times of crisis and evolving career opportunities for librarians, such as global health informationists and disaster information specialists. The evidence briefing is available online on the HIFA page under projects, and you can read more about the findings there. The evidence also pointed out the importance of being aware of local contexts, such as cultural sensitivities, fears, insecurities, and inequity in literacy levels, and recognising that there is a digital divide with regards to access to the evidence. But in developing countries, this is not just during emergencies. In July and August 2017, we held a thematic discussion via the HIFA forum to find out what we know about the availability and use of reliable information for global health emergencies, disasters, and disease outbreaks. The discussion received 78 messages from Ethiopia, Germany, New Zealand, Nigeria, Norway, Tanzania, UK, USA, and Zambia. And the main finding was that there is a huge gap between what is needed and what is available, with each player not having the capacity to deliver to their potential, although librarians can help bridge those gaps. In October and November 2017, as part of last year's Humanitarian Evidence Week, a second thematic discussion took place to find out what people mean by evidence-informed humanitarian action and what kind of evidence is needed by humanitarian workers. This discussion generated 104 responses from Bangladesh, Iceland, India, Nepal, Nigeria, Sudan, Switzerland, Uganda, UK, USA, and Zimbabwe. The key messages from this discussion were that there is no clear definition for evidence-informed humanitarian action, and that the humanitarian sector often relies on lessons learned rather than synthesized evidence. Although PHE's formal involvement with the project came to an end at the end of March 2018, we continue to work with HIFA as a core partner. The next stage of this work was the convening of a special interest group on evidence for global and disaster health. We had been in talks with the European Association for Health Information Libraries, but following discussions with other interested parties, it was agreed that it would make more sense to set up a SIG with IFLA, the International Federation of Library Associations and Institutions, as part of the Health and Biosciences Library section, chaired by Professor Maria Musoke, Uganda's first female professor of information science. In January 2018, the Evidence for Global and Disaster Special Interest Group was convened by Dr. Anne Bryce, Head of Knowledge Management at Public Health England. And in August 2018, a satellite event and open meeting was held at the 84th World Library and Information Congress in Kuala Lumpur, Malaysia. The morning of the satellite event involved a series of 7 presentations on the topic of evidence for global and disaster health, commencing with Professor Virginia Murray, consultant in global disaster risk reduction at Public Health England, describing the role of libraries in supporting the Sendai framework for disaster risk reduction. In the afternoon, we held a workshop on finding the evidence for global and disaster health. And further on in this webinar, Isla and I will highlight some of the freely available quality information sources that we demonstrated during that workshop. The next meeting, the Evidence for Global and Disaster Health SIG, will take place at the World Library and Information Congress 85th IFLA General Conference Assembly, 24th to 30th August in Athens, Greece, and we hope to see you there. This is a photo taken at our satellite meeting. Librarians from America, Australia, Philippines, Uganda, Spain, South Africa, Malaysia, and the UK are represented. Some of you on the call will see yourselves in the photo. I love this photo and feel very proud and honoured to be working alongside all of you, and hope you will join us in this work. I'm now going to hand over to Isla, who will tell you all about evidence aid.
Lovely to meet you all. Do you say that in our webinar? It's lovely to be part of this. Thank you, Caroline. Evidence aid is one of these practical demonstrations of how people that care can make a difference very, very quickly. You may remember on Boxing Day in 2004, the terrible disaster of the Indian Ocean tsunami. So many people were killed, so many lives were devastated, and the destruction that it wrought. Thousands of miles away, Mike Clark, who was a professor and based in Oxford in the UK, wondered what he could do to help. As an information professional, as a clinician, what could he do to help? So he sent round an email to all of those whom Cochrane had contact details for and were affected in the areas, like, what can we do? I'm 1,000 miles away, but what can I do to help? As it turns out, there was a psychiatrist who was working in that area and had been asked and required to give a form of counselling called brief debriefing to survivors of that disaster. And he was wondering, is it really going to be the best use of his time, of the funders' money, and is it going to be of actual any use to the survivors to help them recover from this particular trauma? So the obvious question, what was the evidence? As it turned out, there had been a Cochrane systematic review on brief debriefing relatively recently. It was supplied to him very quickly. They decided that this particular intervention was not going to be as useful as they first thought, and they made a change. They carried out a different intervention, and the main outcome of that was that Evidence Aid was born, and it's been responding to disasters and working proactively since 2004. In practical terms, its aim is to alleviate suffering by providing the best available evidence on the effectiveness of humanitarian action. It's all very well having the evidence, but it's about having access to it, which is sometimes the most challenging aspect, and having access to it in an easily digestible form, because people don't have time to run around trying to get hold of PDFs. They don't have time to try and do lots of analysis. They're working on the ground and in the field, so they have to get access very, very easily. Evidence Aid try and achieve the objective by increasing the use of best available evidence. They also try and develop understanding of the aims and objectives of Evidence Aid among their peers. So part of this is outreach work, which I'm involved in right now. And of course, they need to be financially sustainable to achieve these objectives. But in practical terms, what this means is about gathering together high quality evidence, current evidence, that's going to be appropriate for a whole range of different humanitarian and global health situations, which are in a crisis situation or in an immediate emergency disaster zone. They have a variety of collections, and these collections have all been put together with partner organisations which are packed with experts from a whole range of backgrounds which are appropriate to that particular topic. So there are information professionals involved, but there's aid workers, there's charity workers, there's people who have a direct experience of working in, for example, malnutrition emergencies. There's a whole range of organisations whose expertise has been brought to bear to create and to analyse the evidence that's behind these particular collections. They work closely with Cochrane as well. So these are just a sample of the collections. There's more general topics as well, the burns resources, though that could happen after any particular disaster. There's earthquake resources. It's not just about diseases, it's about a range of different circumstances too. And the Cochrane collections are a great resource to have available. The example here is the Cochrane collection for the post-traumatic stress following natural disaster. Obviously, the tsunami was a key element in that. As well as looking around particular collections of evidence, you can search the Evidence Aid material by particular topic, whether it's health issue or humanitarian cluster, person group, if you're interested in, if you've got a particular interest in care for children after a disaster, that sort of thing. So you can look at this information in a whole variety of forms. But all of this depends on support to be able to put it together and actually being put into practice in the field as well. The reason that I'm talking about Evidence Aid is because I volunteer for them and have done for a couple of years now. Started off writing short summaries of evidence, so individual articles happened to be on Zika. I learned a lot about Zika, which didn't stay in my head very long, but long enough to be able to write the summary, put it up onto the website, and increase the access to the evidence as it was generated. I've also been involved in creating and gathering together the literature which forms the basis of the malnutrition collection as well. A much bigger project, but a very satisfying one. And it turns out that there's a great opportunity for me as an information professional to work with Evidence Aid, because it helps me practice a variety of professional skills, as well as supporting Evidence Aid in achieving their aims of disseminating and distributing the best evidence which might help people in the field. So I would thoroughly recommend, whether you're an information professional, somebody who's got a particular expertise in a specific subject area, if you're interested in this work, do get in touch. Evidence Aid would love to hear from you, and I'm sure you will be able to contribute in a significant way towards the work that they do. So do please consider it. It's very satisfying, it can be very personally rewarding, it can be very professionally rewarding as well. So I would very much recommend anybody to get in touch directly with Evidence Aid if this work appeals to you. Well, that just gives you a little snapshot of the work of Evidence Aid, and I'm going to pass back to Caroline.
So now we're going to talk about some more resources. The first one we're going to look at is the Disaster Management Research Centre. The National Library for Medicine has set up the Disaster Management Research Centre, pulling together everything needed to provide information support to people working in disaster zones. You can visit the site and or follow them on Twitter. So this is these are some of the resources. They've developed a Disaster Lit guide. So developed Disaster Lit, which is a guide to disaster medicine and public health emergency literature and related information. There are also several tools to help first responders and first receivers in hazardous material incidents, guidance about planning, response and recovery related to chemical mass casualty incidents, and guidance about clinical diagnosis and treatment of radiation injuries during radiological and nuclear emergencies. They also provide access to a collection of apps and other mobile-based tools for emergency preparedness and response. They provide health-related information about natural hazards and man-made disasters, including hurricanes, floods, tornadoes, fires, wildfires, droughts, extreme heat, earthquakes, oil spills. And they also provide information about infectious diseases, including pandemic or potentially pandemic influenza and other epidemics and disaster-related disease outbreaks, including Ebola, Zika virus, emerging infectious diseases, past pandemics, and virus variation. They have disaster information specialists on their team who provide a disaster and public health emergency related health information resources, including training and monthly webinars and searching guidance. And they also have a comprehensive bibliography of the literature about library support in times of disaster. Finally, they have a collection of resources about topics of concern to disaster medicine, public health and emergency preparedness, including coping with disasters, children in disasters, pregnant women in disasters, animals in disasters, mass gatherings, disaster recovery, ethics in disaster medicine and public health, and US government sources of emergency and disaster health information. We aren't demonstrating these resources, but we hope that you'll get a chance to have a play around because we're providing all the links. And then if you have any questions, you can either ask them during the session or ask them after the session. We'll leave you with our contact details. So I'm now going to hand over to Isla, and she's going to talk about the next resource.
TRIP, Turning Research into Practice. I particularly like this tool because it's multifaceted in its use. It started, John Brassey started this particular resource as a way of supporting general practitioners, family doctors, pulling together a high quality information very, very easily, because they weren't going to be doing searches of PubMed that would gather together thousands of hits and then do all the selection. They wanted a quick and easy way of getting high quality evidence that could answer their clinical questions. So he created this resource which evolved into this TRIP, Turning Research into Practice. It's really easy search interface. It does have a premium option which you can pay for, but it's free in the first instance. And what it does is generate a set of results in response to the particular topic that you're looking for. But you can see down the right-hand side here, it divides it up into levels of evidence, and the little icon for each particular entry identifies the level of evidence that the item matches against. Again, not all of the resources are available free. You can see items from WHO and also from PLOS One. They're both going to be free, but Dynamed Plus perhaps and BMJ Best Practice may not be free resources in the example site that I've got available. It will vary depending on where you're working and everything else. But knowing that a piece of evidence exists is half the battle. You can make a more complex search because there's a PICO format. So for those of us that like dividing questions into population or patient intervention comparison outcome can work in that style. So you can make your search a little bit more tailored, but clearly just putting in a couple of terms into the search box would do the job as well. What's particularly nice from TRIP's perspective is that if you scroll down on the right-hand side of the screen, the evidence type box develops into an option with further refinements, which includes developing world specific or sensitive options. Clearly not all disaster health happens in low middle income countries. The fires in California will be testament to that. The floods in North Carolina, which happened earlier this year, would be testament to that. Clearly disasters happen all over the world, but there's a particular struggle to find information that's particularly relevant in low middle income countries. So it's nice that TRIP have that particular refinement. And if I apply it, you can see that it focuses down on results and resources which have a little bit more application to countries in that particular in that designation. That would be the word. So turning research into practice, quick and easy to use, with a focus on low middle income countries, if that is the area or the geography that is going to be of particular use to you. I'm going to pass back to Caroline.
So now we're going to have a look at Medbox. Medbox was launched in October 2013 and is a freely available tool of evidence-based resources developed to support under-resourced countries. It is targeted at national and international actors of health action and humanitarian assistance and development contexts alike. People can access these resources using their smartphones to access the internet, and some of the content is available in different languages, including French, Spanish, and Arabic. There are 12 toolboxes. You can see them all here. Ebola, natural hazards, which provides situation reports and updates on natural disasters. Conflict, which includes situation reports on Syria, Sudan, the Myanmar, Bangladesh, Rohingya crisis. The Zika virus, tuberculosis, cholera, leprosy, and polio. There's also one for rapid response, which contains situation reports and guidelines on different disease outbreaks, including yellow fever, the plague, Zika virus, and cholera. There's one for refugees, which includes health guidelines for sexual violence, dental health, unaccompanied refugee minors, screening, pregnancy, and mental health, along with handouts for refugees and migrants in the various languages. There's a toolbox on disability, and then finally there's one on specific hazards such as radiological and nuclear hazards, chemical emergencies, explosives, and bioterrorism. Definitely recommend having a look in each of these boxes. They're just a wealth of information and vital to any humanitarian team. So this slide shows you a screenshot of the Medbox for the Zika virus. As you can see, it contains situation reports, public health guidance, clinical guidelines, and content that can be used for communication messages about the Zika virus. So that's Medbox. I'm now going to hand you back to Isla, who's going to talk about yet another resource.
There's just so many useful things, isn't there? WHO Global Index Medicus is a tool that I think is incredibly valuable. There's so much bias built into the standard databases that I use on a daily basis in terms of Western, Northern produced material, in terms of English language based material. There's massive bias there. So having access to something like the Global Index Medicus is really, really helpful to overcome some of those biases. It covers regional indexes, including, there's LILACs there, which is Latin American and Spanish literature. There's African Index Medicus, East Asia Index Medicus. There's a whole range of different regional focuses, which are really, really helpful. As a search interface goes, it's got a relatively simple search box, but there is an advanced search there, so you can make something a little bit more complex out of your search. And it's also possible to narrow down according to the index that you're wanting to use as well. If you want to, if you're interested in the Americas but not in Southeast Asia, then you can make that selection and narrow down your search, which is really quite helpful. You can make a more complex search strategy, which all my examples are based around Zika, so apologies for repetition there, but it's very easy to use. The nicest thing about it is that you can export whole sets of references in one fell swoop. So if you're using EndNote or a reference manager to gather together sets of references from a variety of different places, it's really, really helpful for that. I've been reassured by the lovely people at the information services at WHO that there's going to be a full guide to using Global Index Medicus coming out a little bit later in the year, and I'll certainly be looking out for that just to make sure that I'm getting best use of this particular tool. But in terms of expanding the reach beyond the standard databases, if I can call them that, the PubMed and Medlines of this world, then it's a really useful resource. WHO also put together an online interactive training resource, Open WHO. And this is about supporting first responders who are going out into very difficult situations to make sure that they're sort of prepared, that they're trained up, that they're aware of all the different issues, and have an opportunity to learn from each other as a resource as well. So WHO, you can see that there's training materials available for particular current outbreaks, but also for more general topics as well. What they do is allow online learning. There's online chat forums and discussion groups, there's collaborative space, and you can check your progress as you work your way through these particular resources. And you can obviously see there's an option for the language that you're seeing this resource in as well. I think it's a really good tool to be able to share with colleagues who are going out into the field, just so that they've got another way of preparing themselves, of getting up to speed with the sort of situations and that they're going to be coming up against. There's a little pre-test, post-test, so you can test yourself as you go through to demonstrate your learning. But again, as I think the discussion options are of particular value for people that are going into the field, and particularly perhaps for people going in for the first time. So that's certainly a tool to direct clinical colleagues towards to help them prepare. We're on to the next resource. Caroline.
Well, we're really whizzing through this actually. But coming back to WHO Index Medicus, working for Public Health England, we do a lot of research into air pollution, and I found WHO Index Medicus really useful for finding research on air pollution. And also when we were doing the sugar tax review, there was a lot of evidence in Mexico and Brazil. So again, I wouldn't have found that using the standard databases. So it's very much worth looking at those resources, not just for disaster and emergency searching, but also for looking at climate change. So now I'm going to talk about the International Initiative for Impact Evaluation, also known as 3IE. This organisation, they produce systematic reviews, impact evaluations, evidence gap maps, and a series of briefs which summarise all of this work. They also include summaries of 3IE's research programmes, lessons from grant making, and instances of uptake and use of evidence. These last briefs highlight instances of evidence use from 3IE supported studies. The link between evidence and its use is often not immediate or directly attributable. Through various sources like grant documents and in-depth interviews with key stakeholders, these briefs investigate how context actors and other mechanisms contribute to uptake and use of evidence. 3IE funds systematic reviews and produces briefs which summarise the main findings of the systematic reviews, along with implications for policy, programming, and further research. The evidence gap maps then map the systematic reviews and impact evaluations in a sector or subsector. For the briefs about impact evaluation, the main findings, lessons, and recommendations from 3IE funded impact evaluations are summarised and published in their impact evaluation report series. The learning summary briefs summarise major lessons 3IE has observed in the implementation of 3IE funded studies. They can cover a range of issues such as study design, methodology, implementation, and engagement. And where they fund a portfolio of evaluations in a sector, learning may be based on what they find across a number of studies. They also provide briefs which provide overviews of their working programmes or specific thematic areas. One collection of briefs summarises the findings from internal replications of development impact evaluations. And finally, the working paper brief summarises findings or provide highlights of 3IE working papers, which compile a series that focuses on current debates in evidence generation and use. Policy relevant papers in the working paper series also synthesise findings of mixed method impact evaluations and systematic reviews to offer new analysis and recommendations. So this is an example of one of the topics, mapping the evidence on WASH, water, sanitation and hygiene promotion in communities, schools and health facilities. So you can see you've got just a brief summary. You can see all the products on the left in the menu, the briefs, the systematic reviews and the impact evaluations, and also the evidence gap maps, and you can get all this information freely available. So this is the evidence gap map for the same piece of work. The image is really tiny, I know for looking on here, but if you go and look, they're very clear and easy to print out. But I just wanted you to see what they look like. It's best if you go to the actual gap maps and explore further, but basically if you hover over a bubble, you will see the links to the relevant studies. So that's the International Initiative for Impact Evaluation. While we've been talking, discussing things, there's a resource I came across which I haven't put a slide for, but I just wanted to mention it. It's called the Critical Thinking and Appraisal Resource Library. And it was developed in partnership with, between Norway and Uganda. And they were finding tools to help people critically appraise health information. And they developed a collection called CARL. And I will post about the link on Twitter, and I'll put it in the chat in a little while. But basically, it's just a collection of resources to help teach children, undergraduates, graduates, professionals, how to communicate treatment claims and how to assess treatment claims that they may read. And it's got a really great video and a book, and it's been very well collected together and well done. So I definitely recommend taking a look at that, and I shall post the link in a little bit. But for the moment, I'm just going to finish off. As I said, we seem to have really sped through this, but that's all right. You can have an early tea break. So those are the 6 resources we wanted to show you. I'm sure there are many more that I know there are many more that we haven't covered. There may be some that we don't know about that you might want to let us know about. Please do, I'll give you our contact details in a moment, but if you could send us anything you think might be useful. This is a Padlet I created. I don't know if anyone uses Padlet, but it's a really great way of collecting resources for a workshop. And you've got all the links there, so you can access that link and you'll have all the resources we've looked at today, plus more. All the resources are freely available. We wanted to make sure that everything is available to everyone, so that's healthcare for all. Further on to the right of the screen, you'll see links to additional content. I just couldn't fit it all on the page, and includes slides of some of our presentations, details of the training we've delivered, and also details of training and networks that are available. So there's the HIFA forum, there's a disaster discussion list, and there's also Chain, which is a network, which is really has a lot of targeted questions. But if you think anything is missing from any of these lists, please let me know so I can add them and we can make it an evolving resource. Finally, we have produced a guide to finding the evidence for global and disaster health. It is very much a work in progress. There is just so much out there, and with all of your knowledge, and we've been gathering knowledge from the HIFA forum and from evidence aid networks. So like I say, please do let us know what you think of it, where we can improve it, what you think's missing, particularly foreign language documentation, guidance. So the leaflet, it has guidance on how to do evidence-based practice, how to do systematic reviews, how to search, how to critically appraise information. So you've got all this information on this leaflet. So, gosh, yes, okay, we're a little bit early. But thank you very much for listening. If you've got any questions, we've got any questions, please do get in touch and do follow our progress on Twitter. As I said, we've got hashtag E4GDH. We've got hashtag HEW2018 for Humanitarian Evidence Week, which is running all this week. And if you go to the Evidence Aid website, you will see lots of events taking place this week. And then if you want to follow HIFA or join HIFA, because it's a very useful discussion list, if you go to @HIFA, HIFA_org for healthcare information for all. So thank you. And are there any questions?
You can use the chat box to submit any questions. Clearly, we'll be delighted to get any emails after the event as well, if it takes a little longer to formulate a question.
We will be circulating the slides and the link to the presentation after the recording afterwards. If you'd rather say your question, we can. There should be a put your hand up option under the participants list, and we can figure out.
We'll be able to unmute.
Yes, we'll be able to unmute you. Oh, thanks, Deborah. Yes, we will definitely send the slides around. So, doesn't look as though there are any questions. Isla, Emma, do you have anything more to add?
Apart from the fact that we've muted everybody, perhaps everybody's been stunned into silence.
Oops.
Just to add that when we send around the presentations and the link to the recording, there'll also be an opportunity to sign up to hear more about the work of the Evidence for Global Health and Disaster Information SIG, because we're very new and
sorry, we're juggling with the mute buttons because we're in the same room and it goes for feedback in horrible. Sorry, Megan, thank you for your comment about knowledge management work we do. Yes, at Public Health England, we try and support knowledge management throughout the organisation to make sure we're sharing our resources and also learning from others. And this work here with Evidence for Global and Disaster Health is part of that. We want to improve access to information for everybody, and the best way we can do that is to work together and improve the resources that are available. The guide I mentioned, we're hoping to translate. We're looking for funding for that at the moment, and hopefully that'll be translated into different languages. It'd be useful to know what sort of languages it would be good to translate into, and then we'll see how much budget we have and what resources. With Health Education England also have a really good collection of resources on knowledge management and how to carry out active after-action reviews, how to set up communities of practice. So Health Education England, I can't remember, I think it's www.hee.nhs.uk, but I will have a look and add this link to the slides. But yes, so we are doing some knowledge management work. So thank you, Megan. Any more questions? Thank you for all the nice comments. And yes, thank you, team. Please do send your questions later. At the beginning, you mentioned the difference between using evidence after an intervention, for example, in its evaluation rather than before. Can you expand on this, and have you seen any changes? Is that you, Amy?
I think I perhaps just to, maybe I'm misinterpreting, Louise, but thank you for your question. You're talking about the evidence around the use of the Cochrane review about brief debriefing and that evidence having been gathered before and it being applied afterwards. Assuming that that's what you were talking about, in terms of evaluating the impact that evidence has made to other situations, I'm not aware of any, but I can certainly investigate and see if there are any examples of situations where in a disaster situation, for example, they were going to do X, they received evidence and they chose to do Y instead on the basis they made that change. Evidence-based medicine is based around that premise. But clearly in the initial setup of evidence aid, they were going to use brief debriefing. They received information which made them change tack, and they applied some different intervention. As I say, I don't know other examples like that, but I can certainly investigate. It would demonstrate the value of an organisation like Evidence Aid very beautifully. So I'd be surprised if they weren't able to collect and to give some little case studies like that as well. But I'll certainly look into that. On the topic of multiple language material, Evidence Aid do make a point of trying to make sure that at least the summaries of the articles are made available in more than one language. And as you look across that website, you'll see that there's French and Spanish are one of the key languages which are used. But I think in terms of going away and having a play, lots of people have said they were going to have an explore and experiment with some of the resources. I think because everybody will have a particular topic of interest that they have, I think going across them and looking in detail about that particular topic is going to be the best way of getting an understanding of just the value of them, the value of them to your work, and also in relation to your understanding of the topic. So playing is such a good way of learning more.
I've just posted the link to the critical appraisal library I've mentioned, so I hope you find it's useful. Oh, do you know if the different platforms have different inclusion criteria for evidence? For example, are some platforms very stringent in including articles in their database and are others milder? Personally, I would think all the resources that we've looked at today, I would say do have very tight controls. I mean, the World Health Organization resources, the International Initiative for Impact Evaluation, there are a lot of organizations that are involved in producing the content on there. They have robust methodologies which they describe on the site. And like I said, the 3IE one, they do evaluate that, they have their lessons learned. So they do take a check and look at what's been done, at how the methodologies they've taken and learn from them and try and improve what they're doing. Medbox definitely does have a very rigorous process, and you find all the information on their website.
TRIP will have a policy of identifying the source of the information and checking that that's okay. And then, I mean, all of the information that you'll find on TRIP, you'd be able to find through a Google search. That's one of the benefits of it. So what TRIP does is say, well, let's do that, but without all the rubbish that you would get through your Google search, and just identify quality sources of information, not necessarily the individual papers from a particular journal, but if the journal is generally reputable, they would cover that, or if the resource is generally reputable, they'll cover that. So while it may not go down to individual papers, the sources of the information will be assessed, and it is not going to search across any old rubbish. It's going to have a limited range of websites that it will scrape to get the search results. Evidence Aid, they sort of appraise each paper that goes up, so that the paper may go up even if it's a poor systematic review, but the summary will demonstrate that it is perhaps the level of quality that it's at, that it's maybe compromised because of poor reporting or whatever. So again, sometimes it's just a case that a systematic review has been done on a particular topic, but obviously you need to be careful of the quality of it. But sometimes, depending on the topic, any evidence is worth reading for people who work in that field. And it's like anything else, we all need to be conscious, because we're using information in a particular way. It's not just a carte blanche of it's up, so it's good. For you, it could be good. For me, it could be not good enough. And vice versa. It will depend.
Yeah, and Disaster Management Research Centre, that was set up by the National Library for Medicine by some very qualified librarians. So again, they have got methodologies in place and people advising on how to select the content. So again, I think that's a good, reliable resource which has robust methodologies in place. I would be interested. I mean, some people have said what their job roles are and who they work for. And I know there's someone from the Belgian Red Cross. And it'd be interesting to know if you're the librarian, if you have just trying to think whether you have access to library services, and if you have produced any resources that we should be including on our list. And that applies to everyone on the call. It would be very useful for us to know what resources you're producing, so we can add it all together and build it up into a better collection. Now, I think there was another message, or got another 2 messages. Oh, okay. So thanks, Megan, and thank you, team. yeah, so how are we doing?
Okay, so that leaves me to say a big thank you to Caroline and Isla for their sharing all their knowledge today, and to you for participating as well. I think it's been a really interesting and interactive session, and we, as I say, we'll make everything available. We'll have another webinar coming up early in the new year, and that will again feature one of the presenters at the satellite meeting that took place in August, expanding on her work. So there'll be more information about that available via our web pages. Do keep in touch.
Thank you.
Thank you.
Thank you
very much.
Thank you.
Thank you.
Bye.
Bye.